Imagine a patient comes to the emergency department with a severe muscle spasms, tingling around the mouth, and even convulsions. Surprisingly, the problem is not in the muscles or the brain. It's simply because of the blood calcium levels has fallen. On the other hand, if the calcium becomes too high, the patient may develop kidney stone, constipation, bone pain, and even altered consciousness. So, one of the most important minerals can affect your bones, muscles, nerves, heart, blood clotting, and hormones. In today's lecture, you will understand the calcium so conceptually that you won't need to memorize it again. Before we begin, let me tell you why calcium is one of the most important mineral in MBBS. Students usually think calcium is only means bones and teeth, but the today's but that's only a small part of the story. Calcium is one of the most frequently asked minerals in exams, and questions are asked on the functions of calcium, regulation, hyperkalemia, hypocalcemia, rickets, vitamin D, and parathyroid hormone. And clinically, calcium disorders are encountered in medicine, surgery, pediatrics, orthopedics, endocrinology, and emergency medicine. So, understanding calcium today will help you throughout the MBBS. So, first, let's understand the calcium actually is. Calcium is the most abundant mineral present in the human body. Remember the word the most abundant. Why? Because our skeleton acts as a giant calcium bank. An average adult contains about 1 to 1.5 kilograms of calcium. Pause for a second. One of 1 to the 1.5 kilograms is a huge amount compared to other minerals. Now here's an important question. Where is all this calcium stored? Around 99% calcium stored in the bones and teeth. Think of the bones as a calcium warehouse. Whenever the body needs calcium, bones can release it. Whenever excess calcium is available, bones store it again, so bones are not dead structures. They are living tissues continuously exchanging their calcium with blood. Now, what about the remaining 1%? Although it's only 1%, this tiny amount is actually the most important. It is present in blood, nerves, muscles, and other soft tissues. This is tiny fraction performs almost all physiological functions we will discuss today. So until now remember three facts. Calcium is the most abundant mineral. Total body calcium is about 1 to 1.5 kgs, 99% stored in the bones and teeth, and while 1% is performs essential body functions. Let's see the development of biochemical functions in the development of the bones and teeth. The first and most obvious function, and but let's understand how. The bones are now made up of calcium alone. They require both calcium are not made up of calcium alone, they require both calcium and phosphate together. These combine to form crystals called hydroxyapatite. You don't have to memorize the chemistry now, just remember the hydroxyapatite gives bones their hardness and the strength. Imagine the constructing building. Cement alone cannot make a strong wall. You also need bricks. Similarly, calcium plus phosphate together provide physical strength. Now another interesting point that bones are dynamic. And what does dynamic mean? They are constantly changing. Old bone is continuously removed. New bone is continuously formed. Two important cells do this work. Osteoblasts, that the blast is equals to build, and these cells build new bone. And next, osteoclast. Clast means crash. These cells break down bone. Why does the body break bone? Because sometimes calcium is required elsewhere, so osteoclasts release calcium into blood. Later, osteoblasts rebuild the bone. This balance keeps our skeleton healthy. If osteoblast activity decreases or osteoclast activity increases excessively, the bones become weak, and this is one of the mechanisms behind the osteoporosis. Now let's move to one of the most important physiological roles, muscle contraction. Can muscle contract without calcium? No. Here's how. When your brain sends signal to lift your hand, calcium is released inside the muscle cells, and calcium binds to protein called the troponin C. And once calcium binds to troponin C, another protein called tropomyosin moves away and the actin and myosin can interact. This interaction produces the muscle contraction. No calcium, no contraction, simple. Your notes also mention that the calcium activates ATPase. Why is the ATPase important? Because ATP provides the energy needed for muscles to contract. Without ATP breakdown, muscle cannot generate the force. So calcium not only starts contraction but also helps to machinery work efficiently. Patients with the severe hypocalcemia often develop muscle cramps, tetany because the muscles become abnormally excitable. Then let's imagine you are accidentally cut your finger. Why doesn't bleeding continue forever? Because blood clotting starts immediately. Blood clotting occurs through the cascade of the clotting factors. Among these factors, factor 4 is the calcium. Without calcium, many reactions in the coagulation cascade slows down or fails. That's why the calcium is essential for normal clot formation. Very important question asked in university that which clotting factor is calcium. It is the fourth factor. Now think about how one nerve cell communicates with another. When nerve impulses reaches to nerve endings, calcium channels open and calcium enters the nerve terminal. This triggers the release of neurotransmitter through the synapse, and those neurotransmitters carry the message to the next cell. Without calcium, communication becomes between nerves and become nerves become defective. That's why the calcium is essential for normal nerve impulse transmission. In hypocalcemia, nerves become overly excitable, leading to tingling, muscle spasms, and tetany. Next function is membrane integrity and permeability. Our cell membrane is not just a covering; it is carefully controls what enters and leaves the cells. Calcium helps stabilize this membrane. It regulates movement of the water and different ions across it. And think of the calcium as the security guard controlling the entry gate of the cell. Then next one is the activation of enzymes. Many enzymes remains inactive until the calcium activates them. Examples are lipase, ATPase, and succinate dehydrogenase. Instead of memorizing each enzyme, understand the concept. Calcium acts as an activator. It switches the certain enzyme from an inactive to active form. Once activated, these enzymes perform their biological functions efficiently. Let's see the important MCQ. The clotting factor is calcium is which? Fourth, second, sixth, or eighth? Absolutely fourth. Let's see the next function. Think about this. A pancreatic beta cells has already produced the insulin. But what tells the cells to actually release the insulin into the blood? This answer is calcium. Inside the cell's secretory vesicles store hormones and enzymes. When the calcium enters the cell, it triggers these vesicles to fuse with cell membrane, and this process is called as the exocytosis. Imagine a courier van carrying a package, and the package cannot reach to the house until the van reaches your gate and unloads it. Similarly, the calcium tells secretory vesicles now it's time to release your contents. Without calcium, the hormone stays trapped inside the cell. Your notes also mention the microfilaments and microtubules. These are like railway tracks inside the cell, and they help transport secretory vesicles to the cell membrane. Calcium regulates these structures and making secretion smooth and efficient. Next function is calmodulin mediated action of the calcium. Now comes a favorite university question. Students often memorize the word calmodulin but never understand it. Let's simplify it. Calcium cannot directly activate every enzyme in the body. So it needs the helper protein, and that the helper is the calmodulin. Think of the calcium is a key and think calmodulin is a lock. Individually, they do nothing. When calcium binds to calmodulin, a powerful calcium calmodulin complex is formed. This complex activates the many important enzymes. Examples include that adenylate cyclase, calcium-dependent protein kinases, myosin kinases, phospholipase, glycogen synthesis. Don't panic and trying to memorize all of them. The examiner mainly wants to know that the calcium acts through calmodulin to regulate multiple enzymes. This is the commonly asked short note. Always remember, calcium alone is not enough. Calcium binds calmodulin first. Here's the next function. Here the concept students often find difficult. So let's understand it with simple example. Imagine your principal wants to announce a holiday. Principal doesn't go to every classroom. Instead of message is passed through class teachers, and similarly many hormones cannot enter the cell. They send their message through using secondary messengers. One of the most important secondary messengers is calcium. When a hormone binds to receptors on the cell structure, calcium inside the cell increases. This increased calcium carries hormones message to different enzymes. Your notes mention an important example, that epinephrine. Epinephrine in liver cells, instead of directly acting inside the cell, epinephrine increases the intracellular calcium, which activates the glycogen breakdown. Another interesting point, some hormones use both cyclic AMP and the calcium, and for example is ADH acts through both calcium and AMP, cyclic AMP. Many drugs influence calcium signaling because it regulates numerous cellular responses. Next function closely related to secretion is hormone release. The calcium facilitates the release of several hormones from endocrine glands. The calcium examples here includes that the insulin, parathyroid hormones, calcitonin. Remember this carefully. The hormones may already synthesized that, but without the calcium, efficient release becomes difficult. Think of calcium as a pressing the send button. Students often confuse hormone synthesis with hormone release. Calcium mainly helps in hormone release. Next function is contact inhibition. This function sounds difficult but is actually very simple. Our body contains billions of cells. These cells must stick together properly, otherwise tissues will fall apart. Calcium helps cells adhere to each other, and special adhesion molecules require calcium for proper functioning. This maintains the tissue architecture. Your notes also mention cell to cell communication. Cells constantly exchange signals. Many of these interactions depend on the calcium. Think of bricks in a wall. The bricks are cells, and the cement between them is like a calcium dependent adhesion. And last function is, finally let's talk about the heart. Every heartbeat depends on the calcium, and when calcium enters the cardiac muscle cells, the contraction becomes stronger. Your notes mention that calcium prolongs systole. In the simple words, calcium helps cardiac muscle contract effectively. This is why disturbances in calcium levels can affect the heart rhythm. Severe hypercalemia or hypocalcemia may produce ECG changes that dangerous for our heart. Then we will see the dietary requirements. Adults require approximately 800 mg per day. Pregnant women, lactating mothers, postmenopausal women need around 1.5 grams per day because calcium demand increases. Children require zero point 0.8 to 1.2 grams per day, and infants require 300 to 500 milligrams per day. You don't have to memorize every number perfectly. Remember one principle: whenever growth or bone formation increases, calcium requirement also increases. The source of calcium, the best dietary source is milk and milk products. Good sources include beans, leafy vegetable, fish, cabbage, and egg yolk. Whenever a patient asks how to improve calcium intake, milk remains the first recommendation. Now let's talk about the where calcium is absorbed. Main absorption occurs in the duodenum, and it is the energy dependent active process. But here's an important question: does every calcium molecule we eat get absorbed? No. Absorption depends on the several factors. Factors promoting the calcium absorption, we will see. The first one is the vitamin D, that is calcitriol. This is the most important factor. Calcitriol increases the synthesis of calcium binding protein, and inside the intestinal cells, these proteins transport calcium efficiently. Next one is the parathyroid hormone. Indirectly increases calcium absorption by stimulating calcitriol formation. Third one is acidic pH. Calcium dissolves better in the acidic conditions. And in fourth one is lactose. Lactose improves calcium uptake by intestinal cells. And fifth one is the amino acids, lysine and arginine, also facilitate calcium absorption. Factors inhibiting the calcium absorption, that now let's see what decreases the calcium absorption. First one is phytates and oxalates. They combine with calcium and form insoluble salts. Example include spinach oxalates and cereals phytates contain. Second one is excess dietary phosphate forms insoluble calcium phosphate. Third one is alkaline condition, that less calcium remains soluble. Fourth one is the fat malabsorption, means the free fatty acids combine with calcium to form insoluble soaps. And fifth one is excess dietary fiber. Fiber reduces the calcium absorption. Next we will see one important MCQ, which vitamin is most important for increasing intestinal calcium absorption. It's vitamin D, means calcitriol. Let's see next part. Imagine two patients come to the hospital and has a low calcium in the blood and develops severe muscle spasms. The other has high calcium and develops kidney stones. Now here's the interesting question: how does our body maintain blood calcium level within such a narrow range every single second? Today we are going to understand the three powerful hormones that controls the calcium levels: calcitriol, parathyroid hormones, and the calcitonin hormone. Once you understand this, calcium metabolism becomes incredibly easy. Here's let's discuss about the plasma calcium. First, understand what is plasma calcium means. Although almost all calcium is stored in bones, small amount circulates in our blood, and this circulating calcium is also called as the serum calcium. Most blood calcium is present in the plasma, not inside the blood cells. Why? Because red blood cells contain very little calcium. So when we measure the serum calcium, we are mainly measuring calcium developed in the plasma. Now remember, the normal value is 9 to 11 milligram per dl. This number is extremely important. If the calcium falls below this range, patient develop hypocalcemia. If it rises, hypercalcemia. And the body therefore works continually to keep calcium between 9 to 11 milligram per dl. Here's one diagram, pie diagram, that contains the calcium in which form. Now comes another concept. Is all calcium in the blood equally divided? No. Calcium exists in three forms. And first form is ionized form, which is about 50% of the total calcium exists in ionized form. And in this is the biologically active form. Whenever muscle contract, whenever nerves conduct impulses, whenever blood clots, it is ionized calcium that performs these functions. So if someone asked which form calcium is physiologically active, that is the ionized calcium. Second, the protein bound calcium. It is about 40% attached mainly with the albumin and lesser extent to the globulins. Protein bound calcium cannot easily leave the blood vessels, therefore it is non-diffusible. Imagine the calcium sitting inside us, and as long as it remains inside, it cannot perform work outside. Third form is the it is around the 10% complex calcium. It combines with citrate, bicarbonate and phosphates, and it is the diffusible form but less biologically active than the ionized calcium. So remember, normal serum calcium is 9 to 11 milligram per dl, ionized 50%, 40% protein bound and 10% complex. The body maintains calcium level using three hormones. These are calcitriol, parathyroid hormone and calcitonin. Think of these three as a members of calcium management team. Whenever calcium falls, rises, they immediately respond. We will talk about the calcitriol. Let's begin with calcitriol. Students often think vitamin D and calcitriol are the same. Actually, the calcitriol is the active form of the vitamin D. It has the chemical name, that is 125 dihydroxycholecalciferol. Don't worry about the memorizing the full chemical name immediately. Just remember calcitriol, it is the active vitamin D. Now, what does the calcitriol actually do? It's primarily action occurs in the intestine. Calcitriol stimulates the intestinal cells to produce calcium binding protein. Then, why is this important? Think of the calcium binding protein as a transporter. It picks up calcium inside the intestine and carries it into bloodstream. Without a transporter, calcium absorption becomes poor. Therefore, calcitriol increases the absorption of calcium phosphate. As more calcium enters the blood calcium level rises. Your notes also mention another important action. Calcitriol stimulates osteoblast activity. Osteoblasts build bone, so calcitriol not only raises the blood calcium but also promotes the proper bone mineralization. Vitamin D deficiency decreases the calcium absorption, leading to poor bone mineralization and rickets in children. So now comes to the most powerful regulator of calcium, parathyroid hormone. PTH is secreted by the four parathyroid glands located behind the thyroid gland, and these glands continuously monitor blood calcium. Now think about this: what happens if serum calcium suddenly falls? Immediately parathyroid glands detect the fall. They release more PTH, higher PTH, then higher calcium, then lower PTH. Now let's understand the actions of PTH. First action on the bone. PTH stimulates bone reabsorption. In simple language, it releases the calcium from bone into blood. Blood calcium therefore increases. In the kidney, PTH increases calcium reabsorption in kidney tubules. Instead of losing calcium in urine, the kidney conserves it. In the intestine, this action is indirect. PTH stimulates formation of calcitriol. Calcitriol then increases intestinal calcium absorption. So ultimately, PTH raises serum calcium through these three organs. Here is the memory trick that PTH pulls calcium higher. Whenever calcium falls, PTH pulls it higher. Always write the three target organs of PTH: that bone, kidney, and intestine. Finally, let's discuss the calcitonin. Calcitonin is secreted by the parafollicular cells, and remember, PTH comes from the parathyroid glands. Now, what does the calcitonin do? Think of it is the opposite of PTH. When blood calcium becomes high, calcitonin release, and actions include promote the calcium deposition in blood and increase the urinary calcium excretion, reduces the blood calcium. Therefore, PTH increases the hormone and calcitonin decreases the calcium. Your notes also mention the important clinical point that is the calcitonin levels become elevated in medullary carcinoma of the thyroid. This is the favorite Viva question. Let's see. The calcitonin increases intestinal calcium absorption. PTH raises the serum calcium. Here is the calcitriol increases the intestinal calcium absorption. PTH raises serum calcium, and calcitonin lowers the serum calcium. Next, we will see about the importance of the calcium and phosphorus ratio. Students usually ignore this topic, but examiners don't. Proper calcium and phosphorus ratio is essential for bone mineralization. If this gets disturbed, the normal bone formation cannot occur. Remember this number: calcium into phosphorus product is around 40 in adults, 50 in children, and less than 30 seen in the rickets. Now, where does calcium leave the body? The mainly through intestine and partly through the kidneys. Normally, the kidneys absorb the most filtered calcium, but when blood calcium rises above renal threshold, more calcium appears in urine. Vitamin D deficiency increases the calcium loss through the feces, and because of the absorption decreases. One interesting point that bone constantly undergoes remodeling, but the adult teeth don't. So once teeth are properly calcified, They don't donate calcium to maintain the blood calcium. That's why the proper calcium intake during childhood is extremely important. Imagine the two patients arrives in the emergency department, and first patient is restless, his hands are tightly contracted and he is having painful muscle spasms, and the second patient is having the severe bone pain, constipation, kidney stones and confusion. At the first, two patients seem completely different, but the real problem is same, that abnormal blood calcium levels. This is one of the highest yield topics from for MBBS university exams. Questions mainly asked on the hypocalcemia, hypercalcemia, tetany, and clinical signs and treatments on them. So first, let's discuss the what happens in the blood calcium levels higher than normal. Here is the one chart that simplifies how hormones are acting on the intestine, blood, renal tubular calcium, and bone calcium for maintaining plasma calcium serum levels, that is 9 to 11 milligram per TL. These are the three muscles: parathyroid, calcitonin, calcitriol. Let's discuss about the hyperkalemia. What is hyperkalemia? It is the simply means the blood calcium level rises above the normal range. Remember, the normal serum calcium is 9 to 11 milligram per dl. Anything above this is hyperkalemia. But why does blood calcium increase? Let's understand the common causes. First one is the hyperparathyroidism. If excessive PTH is secreted, more calcium is removed from the bones and more calcium reabsorbed by the kidneys. More calcium absorbed from the intestine. As a result, blood calcium increases. Second one is excess vitamin D. Too much vitamin D increases the intestinal calcium absorption. More calcium enters the bloodstream and hyperkalemia develops. Third one is the bone destruction. In the diseases like metastasis or multiple myeloma, bone is broken down rapidly. Large amounts of the calcium enter the blood. Fourth one is malignancy. Some cancers produce substances like similar to PTH. These increase the serum calcium, and then we will see about the clinical features. That now comes to the important part. Don't memorize, understand this. Bone pain. When calcium leaves the bone continuously, bones become weak and patient complain of bone pain. Kidney stones occurs. Kidneys try to remove excess calcium. Large amount appears in urine and calcium crystals form in these stones. Constipation occurs. Smooth muscles activity decreases. Intestinal movement slows down and constipation develops. And muscle weakness, very high calcium reduces neuromuscular excitability and patients feel weak and tired. And neuropsychiatric symptoms, patients may develop confusion, depression, drowsiness, alertness, and in severe cases coma may occur. Let's discuss the treatment for the hyperkalemia. General principles include IV normal saline, loop diuretics, biphosphonates, calcitonin treat the underlying disease. Let's see about the hypokalemia. Hypokalemia means the serum calcium level falls below the normal, means less than 9. Hypokalemia. Now here's the interesting question, that why does low calcium produce muscle spasms? Let's understand. When calcium decreases, nerves become extremely excitable. Now, even a small stimulus triggers the repeated nerve impulses, muscles contract continuously. This produces the tetany. Tetany is one of the most important consequences of hypokalemia, and it is characterized by painful sustained muscle contractions. Patients complain of tingling and muscle cramps, carpopedal spasms, laryngospasms, convulsion, etc. Look your own hand. Imagine all the muscle contract together and the wrist flex. The fingers become tightly folded, and this posture is carpopedal spasm. If the muscles of larynx contract, airways narrows, and patient develops difficulty in breathing, this is the medical emergency called laryngospasm. Let's see one special sign, that Trousers sign. inflates the blood pressure curve above the systolic pressure for about 3 minutes. If carpopedal spasms develop, the Trousers sign is positive. Here is one exam point that common causes include vitamin D deficiency, hypoparathyroidism, chronic kidney diseases, magnesium deficiency, and acute pancreatitis. In chronic kidney diseases, vitamin D activation decreases, calcium absorption falls, and hypocalcemia develops. Here is when management depends on severity. In mild cases, oral calcium vitamin D supplementation. In severe cases, calcium gluconate and correction of underlying cause. And never ignore severe hypocalcemia. Laryngospasm and cardiac uh, failures can become life threatening. Let's revise quickly all these. Hypercalcemia, serum calcium more than 11 mg per TL, and in hypocalcemia, serum calcium is less than 9 mg per TL. Let's discuss about the next disease. Look at the child's leg, they are bent and child is short for his age. Walking is difficult. Now here's the surprising fact, the problem isn't just calcium deficiency, it's actually a failure of proper bone mineralization. We will understand the rickets, osteomalacia, renal rickets in a way you will never forget. This topic is one of the most frequently asked MBBS exams because it connects biochemistry, physiology, and other subjects. If you understand why bones become soft, you will answer almost every university question confidently. Why? What is this rickets? Rickets is a disease of growing children causing defective mineralization of growing bones. Notice I said growing children's. Why? Because children still have open growth plates. If mineralization is defective during growth, bone becomes soft and bend under body weight. Why this occurs? The most common cause of the vitamin D deficiency. Without vitamin D, the calcium absorption from the intestine decreases, blood calcium tends to fall, and proper bone mineralization cannot occur. The newly formed bone remains soft. They have the clinical features like knock knees, bow legs, delayed walking, delayed closure of frontally and frontal pausing, and pigeon chest growth retardation. Next, we will see about the renal rickets. If vitamin D is present, can patients still develop rickets? Yes, because the kidney convert inactive vitamin D into calcitriol, the active form. The chronic kidney diseases, vitamin D activation decreases, calcitriol production decreases, calcium absorption decreases, bones fails to mineralize. This leads to renal rickets in children and contributes renal rickets. And always remember, healthy kidneys are essential for the active vitamin D formation. It If the lecture is helped you to understand the concept, subscribe because we are completing the another minerals and another topics from MBBS, and stay growing. Thank you.